Okay, we are going to go ahead and get started. All right, good afternoon, and thank you for joining us for our exclusive KPRC 2 Ask 2 live event. We want to thank you for taking the time to address this really important issue during a time of such uncertainty as we're all experiencing. Our topic today, of course, is the coronavirus vaccine and specifically how it relates to children. We're going to get started here in just a moment after a brief opening statement from our panelists. But first, let's talk about some of the ground rules, Keith.
All participants are going to remain muted throughout the conversation, but we do want to hear from you, so you will be allowed to submit your question on the comment section. If you are comfortable with being in front of the camera.
Hey, Keith, real quick, I think we're having an issue with your audio. It sounds like people can't hear you. I'm not hearing you in my ear, and I know that folks can't hear you either. Yeah, I'll continue then. So all participants will remain muted throughout the conversation, but we do want to hear from anyone who has something to say that want to add. So you will be allowed to submit your questions in the comments section. If you're comfortable with being in front of the camera during this conversation, you can use the raise your hand feature, and then a member of our team will unmute you and you will be able to ask whatever question that you have. So we ask that you remain cordial and respectful at all times. We'll first address questions that were submitted via email and then answer questions that you, the participants, are submitting as well. So we want to introduce our panelists. Joining us today is Dr. Michael Chang. He is a pediatric infectious disease specialist with UT Health and UT Physicians. Thank you for joining us. And also joining us is Dr. Stanley Spinner. He is the Chief Medical Officer at Texas Children's Pediatrics and Texas Children's Urgent Care. We certainly appreciate you both being here, and we appreciate the insight that you can offer us and all of our viewers today. So, Dr. Chang, let's start with your opening statement this afternoon.
Wasn't expecting to prepare an opening statement, but I will say that I appreciate that this pandemic has been going on for about a year. It's been filled with a lot of uncertainty, and I know a lot of people are getting pandemic fatigue, but I do think that these vaccines provide an opportunity, a glimmer of hope for us to turn this pandemic around and get past it so that we can return to some semblance of normalcy in the near future. And so I'm here happy to answer any questions that people have about the vaccines in pediatric patients.
Perfect. Dr. Chang, thank you. And let's hear now from Dr. Spinner. Doctor?
Thank you. And I'll kind of echo what Dr. Chang said. As a pediatrician, vaccinations have always been one of the most passionate things for us when it comes to protecting our children and our families. And so when it comes to COVID vaccine, that's just something that we are thrilled to have available now for our adults, and certainly looking forward to the ability to get that out to our adolescents and then eventually to our younger children, hopefully in the not too distant future. So very happy to be here to answer questions.
Thank you. Thank you. All right. We want to get started with our viewer questions now. Our first question was submitted by Dawn. She asks, if my child has had COVID already, would you recommend them getting the vaccine? Dr. Chang, would you like to start us off? Oh, I think you're unmuted again. Hang on, Dr. Chang. Did you accidentally mute yourself?
Yeah, sorry.
There we go.
Apologies. So if your child's already had COVID, would I recommend getting the vaccine again? Yes, I would. Once the vaccine data is available for the younger age groups, I do still recommend getting vaccinated. And this is true also for adults. What we do know at this moment is that the two mRNA vaccines, the Moderna and Pfizer vaccine, they are 94 to 95% effective in preventing symptomatic coronavirus disease, but that is not 100%. The other thing that we do know a little bit about, but we don't have complete data yet, is how long immunity lasts, both after natural infection as well as after vaccination. And so, you've probably heard about the variants that are starting to circulate in the community, as well as just the original strain. There is some there are some cases of reinfection. So both after natural infection, we don't know about after vaccination yet, but we do know people who have had some infection after getting the first dose of vaccine. So even though we think you will have a period of immunity after natural infection, we don't know how long that lasts. We don't know exactly how protective that will be against reinfection. So even if you're an adult, and I think once the vaccine is available for pediatric patients, even if you've had an actual COVID infection, I do still recommend getting the vaccine.
Thank you for that. And Dr. Spinner, would you like to answer that question as well?
Yes, and of course, I absolutely agree for all the reasons that Dr. Chang said. Infection, we don't know how long immunity lasts from infection, and people certainly of different ages may have different immune system responses to the infection. And so giving the vaccine is going to only boost that and hopefully improve our ability to prevent infection going beyond that. So absolutely, there's no reason not to be vaccinated after infection, but there's certainly good reasons to believe to do so. So the answer is yes, we should absolutely get vaccinated after infection.
Thank you for that. So our next question is coming from one of our viewers. Her name is Brianna. She asks, what is the timeline for when children will be able to get the vaccine? And I know that for the folks and the parents that are wanting to get their child vaccinated, this is a question that a lot of parents are asking. So Dr. Spinner, why don't you start with this one?
Sure. So, we are now actually having studies done on adolescents, so starting 12 years of age and up. And our hope, and what we're being told, is that we would hopefully have vaccination available for our adolescents by this summer. And even hearing that potentially children down to maybe as young as 6 years of age by the beginning of the school year, by the beginning of the fall, that may be available for them. So that's what our hope is at this point.
Say it again.
And Dr. Chang?
Testing.
Yeah, same information that Dr. Spinner just relayed. Pfizer has actually already completed enrollment of their 12 to 15-year-old study group. They haven't released any data from that yet, but they have completed the enrollment for that particular age group. And so once they've had a chance to analyze that information and make sure that the vaccine is safe in that age group, they do plan to start enrolling their next younger age group, which I believe is 6 to 12. Moderna is currently enrolling their 12 to 18-year-olds, and that is ongoing. And I'm not sure how well they're doing with that yet. But as Dr. Spinner said, I would expect adolescents, hopefully by this summer, authorization to use the vaccine in that age group, and then younger school age kids by the fall.
Thank you so much. And I want to bring in my colleague, Keith. I think we worked out the microphone.
Yes.
Issue. Yeah. So viewer Danny has a question.
That's right. Danny is asking, Danny actually says that I'm nervous at the thought of getting my child vaccinated. What can you tell reluctant parents like me to reassure them? And that obviously could go to both of you, doctors.
Well, I can go ahead and take that question first. So I'm a father as well. I have 2 kids. I do understand some reluctance about what feels like a relatively new a vaccine. It's something that maybe people feel like has developed really quickly. But there's 2 things to keep in mind. The mRNA vaccines have been investigated for over a decade in delivery of other vaccines, and similarly the adenovirus vaccines, the Johnson & Johnson and the AstraZeneca vaccines, have been under development for quite some time. And in all those studies and science that's been ongoing in those years, both these delivery systems seem to be safe in the recipients. And certainly now that we have some safety data about the Pfizer and Moderna vaccines, and as well as AstraZeneca and Johnson & Johnson, we can see that at least down to 18 years of age, we have very few serious adverse events. Now, as far as younger children, I agree, we don't have that data yet, but when you look at the technology and kind of how these vaccines work, there's no reason to suspect that there's going to be additional adverse events in pediatric patients relative to adult recipients who've already received the vaccine. So I think the best thing you can do as a parent is know that, number one, So far, there's been very few adverse events related to these vaccinations. Number two, I think you can find information about these vaccines, how they work, and you can learn about them for yourself. And I think you can feel confident once you've educated yourself on how they work that these vaccines will be safe, and I think they will be effective in pediatric patients.
Dr. Spinner?
Yeah, so and I'll add to that. I'm not only my father, I'm also a grandfather, and certainly very eager to be able to get my grandchildren vaccinated at some point when we have the information to show that it is effective. When it comes to safety, I always tell people that children are not the same as adults. They're not just small adults. They are different in some ways, but when it comes to the safety of vaccinations, that's generally not the case. I get a lot of concerns, questions about the vaccines haven't been on the market that long, it's still too new. Well, we're looking at over 43 million doses of Pfizer and Moderna vaccine having been given right now in real time, not in studies, but just out in the community. And again, we're seeing, side effects. We're looking at these so carefully. I mean, the media is watching for this, and we're all very aware of this. And we are seeing extremely small numbers of any kind of serious events. And when you look at the total number of cases of COVID, the number of deaths, the number of hospitalizations, and even in children, everyone always says, well, children really are not much affected by this infection. Well, but they are in some cases. They can get very sick. I mean, here at Texas Children's Hospital, we have children in the ICU every day with COVID. We see complications from it. So it's not a completely benign illness even for children. So the vaccine, we are very comfortable and confident in the safety of the vaccine as it is now. And we'll certainly be certain that when it's released for our adolescents and later on for our younger kids, that we'll have that same safety data to confirm that.
And I would add on another way to think about it, like Dr. Spinner is saying, yes, we've been fortunate in pediatrics to have a relatively, milder experience than adult hospitalists and ICUs have had, but we do see very ill patients with COVID-19. And so when you think about what we're comparing here is the risk of a side effect from the vaccine versus a risk of getting serious COVID infection. And so when you start to compare the risk benefit of those two scenarios, I think if you're concerned about a side effect from the vaccine, you should also be concerned about the potential for serious COVID infection. And so when you start to look at the numbers, 43 million doses given across the country, and then you look at the potential for serious infection in kids, you can see that generally at this moment that the risk benefit is in favor of getting vaccinated rather than taking your chances with getting a serious COVID infection.
Dr. Chang, thank you. And I just want to jump on real fast. And I've seen a few more people join our conversation. So just a reminder, if you, one of the viewers or participants, have a question for one of the doctors if you hear something that you go, hey, I have a question, a follow-up question, feel free to use the raise your hand feature and ask a question, or you can just type it into the chat section, and we will be sure to get your question answered. But just wanted to remind you that this is an interactive conversation, and we're happy to get your questions answered moving forward. So just a quick reminder there. Moving forward, Denise Gonzalez, one of our viewers, she asks, can teens participate in vaccine trials? And if so, where are they able to do that? Either doctor.
Yeah, so I mean, we, as Dr. Chang had said, trials are already ongoing with teens starting 12 years of age and up. I think Pfizer has closed theirs, but I think Moderna is still looking to recruit. I know there are some websites, and Dr. Chang, if you have any specific names of those websites you can offer, I don't have any specific names for them, but I do know that they're out there that you can go to the websites and you can sign up for Moderna's vaccine trial for the adolescents.
Yeah, I usually recommend, these are both being run through affiliation with NIH, et cetera. So the best website to check first is clinicaltrials.gov, clinicaltrials.gov. This is a kind of a repository for all ongoing NIH, associated trials. And so both the Pfizer-BioNTech vaccine trial and the Moderna trial for teenagers are listed under this website. So you can click that website, you can search for these trials, and then you can actually see the participating sites, and you can look for one that's close to you. And this is true for really anybody across the country. You'll see participating sites kind of across the country. The other thing you can do is potentially reach out to Moderna and Pfizer directly and see if there's somewhere near you. But I would start with clinicaltrials.gov. And then search for a Moderna vaccine or Pfizer vaccine, COVID vaccine. And you should be able to find these trials and then look at the participating sites.
Okay, thank you both for that. Amanda, one of our viewers, has a question. She asks, how young will the vaccine go? Will babies be able to get the vaccine?
I can start with that one. I think we are unsure yet exactly, how young we will ultimately de-escalate the age groups down to. I would expect at least down to toddler age, but I think what we need to know is kind of the safety data for each age group as we go forward. And again, it's not necessarily because we're worried about an adverse safety profile, but at the same time, we need to do our due diligence and make sure it is safe in each age group as we de-escalate the ages. So I don't know that as a medical community, I say we and kind of like the royal we, but I don't know that we've kind of predetermined already, exactly how young we're anticipating everyone receive vaccine. But I think I could anticipate, and I don't see any reason why they would be unsafe in infants. But again, I think we're waiting to see exactly how young we think the most effective use of the vaccine will be.
Dr. Spinner, would you like to add?
Well, I would just say I agree with that. We have, as a medical community, that decision hasn't been made yet. I think that over the next several months, as we start vaccinating our adolescents and hopefully our younger kids, I think we're going to need to see, what's happening, what's going on with COVID, and whether or not there is going to be that true benefit of bringing that down to the much younger age groups. Sometimes with certain vaccinations, that's what we do. I mean, we start with kids literally at birth, and others, it's more reasonable to start it at an older age just because of the risk. So I think that's going to be something that we'll continue to evaluate over the next several months.
All right, and we have a couple of questions now in our chat section, and this one is related to vaccines for babies. This comes from Don Campbell. Will protection be transferred to newborns if a pregnant mom is vaccinated?
Well, I can tell from having worked with a lot of our OB colleagues here at Texas Children's, the answer is that we believe that is the case. I don't know that we have an idea of how long that immunity will last, but that, pregnancy, certainly during pregnancy, a lot of protective antibodies are passed down through to the fetus. So we do expect that would be giving those unborn babies and then hopefully in newborn babies some protection from the vaccine for the mom.
Yeah, and I would say that there's already case series and some data about detecting COVID antibodies in newborns born to either mothers that were infected with COVID or we don't really have any vaccination data yet, but there is some very limited data about newborn detection and young babies having COVID antibodies that we think were potentially transferred from the mom and are likely to be protective. Just
Okay.
All right. Thank you both for that. Our next question, I'm curious, actually, Bill is curious, but this is a good question. Based on the data that exists right now during these sort of ongoing trials, are there any kids that we know should not be vaccinated? Either doctor.
I'm sorry, you want to go ahead and start? You can.
No, go ahead, Dr. Spinner.
I think that it's going to be probably the same few contraindications that we see in our current adult population, which is someone who's had a severe allergic reaction to the components of the vaccine or to the previous dose. That's going to be a very, very small population. I think again, someone who is actively sick at the time, generally that would be a reason to delay vaccine. But our children, just like our current adult population, those who are immunocompromised, those who have underlying conditions, really are the highest risk for getting really sick from the infection. So those are the ones that should be the highest priority to vaccinate. So having said that, there's really going to be very, very, very small number of people in children or in any age group really that's going to have that contraindication.
Thank you. Dr. Chang?
Yeah, absolutely agree. I think the primary concern will be severe allergy to any component of the vaccine or severe allergic reaction to a prior dose. But otherwise, it's important to remember this is a completely new virus. And so, there's not going to be any clear association with other diseases and risk of adverse events. And again, as Dr. Spinner said, those patients with underlying diseases, they're the highest risk for severe disease. We do have good data about that. And so I don't anticipate there's going to be many contraindications to getting vaccinated in our younger age groups.
All right, thank you. We have another question from our chat section. This one comes from D. Strauss. This question is, right now the vaccine is for children over the age of 16. How do you decide, I believe the industry, the medical industry, pharmaceutical industry, how do you decide age limitations? Why is the trial for 12 to 16-year-olds? And how's vaccine research trials in general handled for much younger kiddos? In other words, the overall question is, how do you break down the age groups? A lot of parents have those questions.
Sure. So I can address that. So specifically, the 16-year age limitation for authorization for the Pfizer vaccine is ultimately because the Pfizer trial added 16 and 17-year-olds with a kind of a modification later in the trial. So there were some 16 and 17-year-old patients in the Pfizer trials. Now, there weren't very many. It was a few hundred out of the 30,000 patients that were ultimately in the trial. But there was a little bit of safety and efficacy data in that age group. And so ultimately, when the FDA granted the emergency use authorization for the Pfizer vaccine, they did grant it down to age 16. Now, I will say, I don't know how many of your viewers listened to the FDA's meeting about it. There was some discussion, is there enough safety data? Is there enough efficacy data for that age group? And ultimately, with the FDA did determine that the authorization could be down to 16 years for the Pfizer vaccine. Now, the Moderna vaccine did not recruit anybody less than 18. And so therefore, the authorization was granted for age 18 and up. And they're recruiting for 12 to 18 now. Now, how do we determine like that, 16, 17, 12 to 16, 12 to 18? A lot of it is kind of based on, 18 and up, obviously an adult, kind of by legal definitions, et cetera. And then 12 to 18, we often group together because a lot of children have entered adolescence, they've had puberty or are ongoing through puberty. And generally speaking, a portion of kids at 12 have started that. And then 6 to 12, you're kind of in another age group, kind of pre-pubertal kids, but not quite down to that toddler age group. And so it's partly determined by how we think their physiology is related to each next age group above them, if that makes sense. And then I should say that as far, to an earlier question about how young do kids get vaccinations, I think it's important to remember that every vaccine is a balance between when we think they'll be effective and how many doses we think they'll get. So like Dr. Spinner said, some kids get some vaccines we give at birth, and some vaccines we give later. And it's based on, kind of the benefits we think that each individual patient can get based on the age that they're getting the vaccine. So the age of vaccine is not just a made up number that we just kind of like go for the youngest age possible. It is actually based on data where we think they have a good enough immune response to respond to the vaccine. They're at highest risk for having the disease that they're being vaccinated against, balanced against potential for side effects.
I really don't have anything more to add to that. I think that was a very complete answer.
All righty. We like complete.
Yes, thank you. So we have a series of another set of questions regarding vaccines in general from a few of our participants. But I read something recently regarding the CDC recently reported that orders for non-flu childhood vaccines are down approximately 10.3 million doses during this pandemic. The first question is, what is your message to parents? And in regards to the COVID vaccine, when kids are able to finally get the COVID vaccine, is there a waiting period as to when they should get other vaccines? Or what is your message regarding making sure that kids get the measles vaccine or vaccinated against HPV in terms of with the COVID vaccine?
Oh, I can start with that. I mean, my message really to all of you out there as parents is don't let your guard down. Don't stop protecting your children. You know, this year has been a true oddity in many ways. I mean, we've seen virtually no flu in the community. We've seen a lot fewer respiratory infections in general. I mean, I've had some of my docs tell me that they haven't seen an asthmatic in the office for a while, which, you know, is unheard of. And so, you know, I think the fact that we have, you know, kids have been kept at home a lot. We've done the masking, the social distancing. So I think a lot of the safety measures that we've employed for COVID has taken a real toll on other infectious disease, which is a wonderful thing. But we also know that this is not going to last. I mean, we are going to get back to normalcy sooner than later. And these respiratory infections are going to come back. The flu is going to come back. And so we absolutely need to continue protecting our children from these diseases, many of which are deadly. I mean, flu, for instance, unlike COVID, flu does take a huge toll on our very young, vulnerable pediatric population, and it's highly contagious. So vaccinating our children for flu continues to be as important as it ever was before. And indeed, there was just some data I just saw published a couple of days ago saying that children who have been vaccinated with flu vaccine right now, if they get are less at risk of COVID disease. I'm not sure we have a reason for that yet. I think this may just be information that we're seeing. But again, we should not let our guard down against all of these diseases as far as the vaccinations for these other diseases. Timing, and again, this can be tricky because, for the COVID vaccine, because we don't have data to support otherwise, it should be that you should not do a vaccination 2 weeks prior to COVID vaccine or 2 weeks after. So I have a lot of my older adolescent patients that are coming in for vaccinations at age 16. Well, if they're not going to be getting COVID vaccine right then, they should still get their routine 16-year-old vaccinations. And the worst case scenario is if they suddenly the next day they get a call that they're eligible for the COVID vaccine, well, they wait the 2 weeks. But we should not be delaying any of our routine immunizations for that reason.
All right.
I absolutely agree with Dr. Spinner. So, I just want to emphasize the 2-week window between routine vaccinations and COVID vaccine is not because there's actually data that says that it's unsafe or that there's adverse events. It's just that because we don't have data about exactly how these vaccines will interact, there's no reason to suspect that there will be adverse interactions between the vaccinations based on how they work and how the science behind them. But to be extra cautious, what we're recommending is a 2-week window, either in front of or behind either of your vaccines before you get the COVID vaccine. So I just want to be clear, because I don't want anyone to listen to what Dr. Spinner is saying is, oh, what's the 2 weeks about? Well, again, it's just, I think the medical community and the scientific community trying to be extremely cautious to avoid any potential interactions. Again, there's no reason to suspect that there will be, but that's just an extra cautious recommendation to avoid vaccination within 2 weeks.
And I'll add to that, because we do give a lot of vaccinations simultaneously in our pediatric population. But again, those have been studied each individually initially, but then given together to be sure that the effects are there and that the safety is there. And then we can proceed in doing that. And eventually we should expect to have that same data with COVID vaccine and concomitant and the other vaccinations. But right now we don't have the data, therefore we're being cautious.
Okay. All right. Understood. Okay, we have two related questions from participants. The first from Andrea asked, what if all adults in the family have gotten the vaccine, but the kids are still waiting? Can we go ahead and have a family gathering since most people are vaccinated and kids don't usually get sick anyway? And Don adds, related to that question, if grandparents and parents are vaccinated but kids are not, is it safe to have a mask-free, non-socially distanced gathering in our home again? I mean, I think social distance, I think, was the wrong term to use because we are very social creatures. And there's been that desire for people to be with their family members and their loved ones. So doctors, you all have to, I know you understand, and you all have families of your own. People want to be with their family members. So this question is on everyone's minds.
Yeah, that's the $1 million question. And I'm going to give you my version of the answer. Dr. Chang can certainly say, his version. We know that these two vaccines, Moderna and Pfizer, are 94, 95% effective in preventing, illness due to the infection. What we don't know is how effective they are in actually preventing infection. So in other words, we can be affected. We know that a lot of people have been infected with COVID, but have been asymptomatic, but they've still been able to spread the infection. We don't really know for sure if being vaccinated will prevent us from being able to still spread the virus to others that are not yet vaccinated. There is some early data out of Israel to show the Pfizer vaccine that it really does seem to be fairly protective for that, but it's, again, that's very preliminary. So we really don't have that certainty to say that I've been vaccinated, my wife's been vaccinated, therefore we can be around my grandkids and feel comfortable that we can't give the virus to them. We don't know that yet. Our hopes that that's going to be the case, but we don't know that. So until we know that, my advice is that people still keep within their family units the way they were before the vaccine. So if a grandparent was not with the grandchildren, or at least not with them with masks and trying to be cautious, they should still maintain whatever that level of caution was, because we don't know. And I don't know that I could potentially be exposed to the virus, not be sick, but be still contagious and give that virus to my 1-year-old granddaughter. And yes, children generally don't get as sick, but they can get sick. So I, as an individual, would make that choice, and I'm going to still be as cautious now as I was before until we have more information to know that I can't spread it. And we're hoping that's the case, but we don't know that for sure. And that goes for either of the two vaccines.
Yeah, that's exactly right. We just don't know if it prevents transmission. Again, the endpoints of both the Pfizer and Moderna studies were symptomatic COVID disease or severe symptomatic COVID disease. You know, neither of those vaccine trials studied asymptomatic infection or did any type of surveillance during the trial. They waited until patients became symptomatic to determine if they had COVID infection. So we don't know if you can become infected but asymptomatic after vaccination. Again, we think they will be helpful, but we don't know yet. So ultimately, it's going to be up to each family to determine their risk aversion and how much risk they're willing to take. I agree with Dr. Spinner. I'm not planning to change anything. I don't recommend that anyone change their physical distancing, which I've started using physical distancing instead of
A lot better, yes.
Yeah. So I don't recommend that anybody change their physical distancing kind of practices right now. Continue to wear face masks, continue to do your hygiene. And, you know, once we know transmission is reduced by these vaccines, or if we find that out and we can see community levels are down and the overall risk of getting COVID is down, then yes, I anticipate that we will be able to return to normal family gatherings without masks, with our kids, with our grandparents. We're just not quite there yet, and we don't quite have the data from the vaccine trials yet to make that determination.
Dr. Spinner, Dr. Chain, thank you for that. We have a few more questions coming in from some of our participants. Mariah asking, my 16-month-old had COVID in December. I read horror stories about people having complications like heart problems from COVID months later. What are you seeing in babies and kids who have had COVID? Are those kinds of complications rare? Should she be worried?
So the complications are rare. And I would tell parents, you shouldn't be worried, but you should be aware. You know, we do see children of various ages that can and do have some cardiac complications. We try to monitor that. You know, we tell all our families that once your child has been, you know, infected, we follow up with them after a couple of weeks. We want to see what, you know, if they're still symptomatic. We may certainly even have our cardiology colleagues, you know, evaluate them more carefully if they're having certain symptoms. So yes, you can see that, but the majority of our pediatric population does not seem to suffer that. But again, this is an ongoing evaluation. You know, this has been around for about a year or so. We still don't know if longer term that could result in even more of those complications. So another reason why we want to protect our pediatric population from infection. So again, as everyone keeps saying, most kids don't seem to get that sick. That's true, but we still want to be sure that we're going to protect them as best we can as parents and as a society, as physicians, and therefore we don't want them to get infected. But you know, it's a matter of just monitoring for symptoms. And if you're not certain, if you're not sure, I mean, obviously follow up with your physician, your pediatrician, to be sure that if there's a need for them to be seen or they need to be seen by a specialist, certainly that's part of that ongoing evaluation.
Right. Yeah. And I think potentially what you're referring to is the multi-system inflammatory syndrome in children that's associated with COVID-19. I know at Dr. Spinner's hospital, as well as at our institution, we've had patients diagnosed with that particular syndrome. This seems to be a post-infectious kind of issue. So you have your acute COVID infection, and then several weeks to potentially several months later, you develop kind of this hyper-inflammatory response. We don't really know exactly what the trigger for that is, but there are patients, pediatric patients, that develop this multi-system inflammatory syndrome. Now, that said, it's very uncommon, right? We've had several million pediatric cases of COVID-19, and we've had about 2,000 or so across the country multi-system inflammatory syndrome cases. So it is a very rare complication of COVID-19. But it is, and so you shouldn't worry about it on a daily basis if your child's had COVID-19. But as Dr. Spinner said, you need to be aware that this syndrome exists and be on the lookout for potential symptoms like prolonged fever without an explanation, fever with rash. We see pediatric patients with a lot of gastrointestinal symptoms as kind of the primary presenting sign of multi-system inflammatory syndrome. So abdominal pain, diarrhea. So I do think it's important for parents to be aware of this potential complication, but they also shouldn't be expecting it to happen just because their child had COVID in the past. And then, again, I'm sure at Texas Children's, here at Children's Memorial Hermann, patients who we do ultimately diagnose with multi-system inflammatory syndrome do have close follow-up with cardiologists and subspecialists and rheumatologists. And so if there were a concern for cardiac complication, we are following up with those patients.
And just to add to that, again, the MISC is probably the most, severe kind of concern we have. But there are those who could have other just kind of single organ. They can't have just a cardiac anomaly, or and so it's not always just MISC, but it's still rare. But again, it goes to show that you just want to follow up any of these with, if there's persistence of symptoms or the symptoms seem to go away and come back again. Those are things that we just want to be sure that we are aware of and that we can watch for. But again, these are all relatively rare conditions.
All right. Thank you. Thank you both. So, over the next few days, there aren't a lot of people who are going to be thinking about summer because of the weather we're about to experience over the next several days. But if 2021 is anything like 2020, it's going to go by really fast, and summer is going to be here before we know it. Andrea asks a question about summer camp. Should I wait to sign up my kids for summer camp until they can get a vaccine? What are your thoughts on that?
You want to go first, Dr. Chang?
Yeah, my answer is no. Actually, I would not wait for your children to be vaccinated necessarily to sign up for summer camp. I think with respect to summer camp, if we have good measures in place, physical distancing, masks for participants in the summer camp, if we can minimize indoor exposures, we can do activities outside. If we're doing outside activities, and we can minimize transmission of the infection in those ways, and if our community rates are low by the time the summer camp starts, I don't think vaccination should necessarily be a prerequisite before going to summer camp. But the key is the prevention guidance and the prevention interventions have to be there, right? So if the camp is saying, oh, we're going to be mask free, we're not going to do physical distance, we're not going to do any of that stuff, then I probably wouldn't sign up for that camp, vaccination or not. But if the camp is saying we are going to have masks, we're going to have physical distancing, we're going to minimize group sizes, we're going to do all those interventions we've been talking about for the last year, then I don't think vaccination necessarily needs to be a prerequisite for attending summer camp.
I'll agree with that. And I'm going to add a couple other things because we get these questions constantly from our families. It all boils down to, again, level of risk that any individual is willing to accept. But my advice is this, that, if you're going to think about sending your child to a camp, understand what the camp's philosophy is. Like Dr. Chang said, are they going to require masks? Do they have the physical, I like that, the physical distancing? But more important, as important, what are their, what are their contingencies if someone does get sick? Do they have the right facilities? Do they have the right personnel to evaluate these children? How do they get them to where they need to be? A lot is said about, the fact that wearing masks inside and wearing outside is not quite as important. But if you're together, kids are, groups together outside running around screaming, but together, there's still the risk of spread. So, the need to wear masks is still going to be there in many cases if they're congregating in areas. So what is the camp's philosophy as far as how many kids can congregate together? And, children, how we are, well, I'm a pediatrician, so I'm always going to consider myself a child. I'm sorry. But I mean, children tend to just, do what's fun, and they don't always follow the rules. So how vigilant are the camp, staff going to be as far as protecting the children? So I think these are the decisions that as a parent, we need to look at before we decide, am I sending my child to camp at all? And if I'm willing to do that, which particular camp based on what they're, what they have in place. And I agree, the need to vaccinate is a prelude to that. I don't think it's going to be a practicality, certainly this summer. So if you're comfortable with that and you have a camp that you feel is doing all the right things, and you got a 10-year-old or who's probably not going to get vaccinated by the middle of the summer, or an 8-year-old, then I would say then that's the decision. That's how you make that decision.
Thank you. Dr. Spinner, I have a question coming from our viewer, Denise, specifically for you. In your medical opinion, should schools require the vaccine for kids, teachers, and the school staff?
Well, let me say this, as a pediatrician, we really want to have our kids vaccinated for the vaccines that they should get. We want our adults to be vaccinated. So we certainly want to encourage vaccinations. I think from a school standpoint, we want to protect our teachers. We want to be sure that the schools are, if they're opening and having kids come back to school, that they have all the proper safety measures in place. Because I think if we do that, and we do that well with the data that we have from schools, that's not where most of the spread is occurring. It's occurring at the community level. So if the school is if people are masking within the school, if they're keeping that physical distancing, if the schools have the proper ventilation, really that's what's the most critical part of, is it safe for my child or for a teacher to be back at school? I would love to see teachers be able to get vaccinated. But the question is it a mandate? I don't know that that's something I would be able to answer, because I think it's up to individual states and individual school districts. The sooner they can get them vaccinated, the better. But I think if they're practicing all of those factors that I've just mentioned that we've been talking about, data supports the fact that that makes it a relatively safe environment, even without the vaccine.
All right. We have a little less than 15 minutes left, and we still have a good amount of questions. But if any of our participants has any other questions, please submit them in our chat section. We want to get to a question from Don. It says, I know this is a question that gets asked for adults, but is there any new information regarding the frequency of getting vaccinated? Will it be 2 shots annually, or just a booster shot periodically like some vaccines we get for our kids now?
I'll go ahead and take that one, since Dr. Spinner had to answer that school question. But I think the answer is ultimately we don't know yet. If you think about it, the only data about vaccination that we have is less than 3 or 4 months old, right? So again, we are not even sure yet how long the immunity from vaccination lasts. So it is very difficult to be able to answer that question yet. And even as far as the first case of COVID-19 natural infection, kind of wild type infection, that's been about a year, a little over a year. So, we just don't have enough information yet to make an educated kind of like decision about whether or not we're going to need annual vaccinations, annual boosters or not. Now, there is some discussion about the variants, that are circulating, what are kind of known as the UK variant or the Brazil variant or the South African variant. And there is some concern that these variants can escape the immunity that is provided by the vaccines. Now, again, we still don't have a lot of clinical data about this. And so I think it's too early to make a decision. Now, one of the things that is interesting about the new vaccine technologies that are not, I shouldn't say new, but the vaccine technologies that are being used is that they can be adapted relatively quickly to account for new variants. So whether we need a new vaccine for a variant in the future, we don't know that yet. But at the same time, anybody who's out there worried about these variants should know that at least we can respond very quickly with vaccines, with modifications to the vaccines.
Thank you, Michael, Dr. Chang. We appreciate that. One question that I specifically have, we've heard from city and county leaders sort of the desire to get to herd immunity, not just in our communities, but really across the nation. Do we need our child population to get vaccinated in order to reach that herd immunity status?
So that's a great question. I'm sure that, and a difficult one to answer, I will admit. So I think the first thing that a lot of viewers have probably heard about is you need like 70 to 80% of people immune to an infection before you achieve herd immunity. And so, but that really depends. I mean, there's a lot of factors that go into that number, and it is driven by things like who are the primary spreaders of the infection. What is the community that's primarily affected by the infection, and so that number of 70 to 80% immunity for herd immunity to be achieved, it depends on a lot of factors that are unique to each type of infection that we're dealing with. So with COVID-19, we're still learning about it on a daily basis, and generally the principle is yes, you need 70 to 80% of any population to be immune to kind of have less spread of any type of infection, but we don't know that for sure for COVID-19. Now, one thing that again has been kind of good about COVID-19, I guess, is that kids so far do not seem to be the primary drivers of the spread of COVID-19. So it's still primarily adult to adult within the community. So, again, I don't have an exact answer to this. Do I think kids should be vaccinated? Yes. Are they going to be critical to achieving herd immunity? Yes. But at the same time, I think it would be more important to achieve, say, 70 to 80% immunity in adult populations before we necessarily had to achieve 70 to 80% immunity in our pediatric populations. So we will need to vaccinate children in order to achieve herd immunity, but at the same time, we may see decreased transmission of this and really significantly lower case counts if we have a majority of adults vaccinated, even before we achieve high vaccination rates in pediatric patients.
Thank you for that. I appreciate that, Dr. Chang.
Last call for questions. We have a little less than 10 minutes left, so we certainly want you to get your questions in if you have any of those. Question from Don: when vaccines for kids are available, do you expect we will be able to go to our pediatricians to get it, or do you expect it will be large registration events with larger providers like we have with adults right now?
So I think it's going to depend on which particular vaccination. The two vaccines that are currently on the market, the storage requirements are prohibitive for being able to do that kind of at an individual practice level. That's why you're seeing it done at the major centers, the hospitals who have the capacity for the significantly low temperatures that those vaccines need to be stored at. As we get to some of the other vaccines, the Johnson & Johnson, for instance, some of the other ones that just require kind of the normal type of temperatures that we store most of our traditional vaccines for, then that may very well be the case that we may be able to bring those out to our practices like we do all our other vaccines and be able to immunize our pediatric population that way. I think that would certainly be of benefit. Whether that's going to be enough or we're going to need to do that in combination when we're talking about starting everyone with all of our pediatric population to get vaccinated, it may be a combination, but I look forward to the fact that we should be able to bring some of these vaccines to the community practice level as they're out on the market and available for our pediatric population. Our pediatricians are trained to do this. We have the expertise and the equipment. So that's certainly it's not new for us. We do it every day.
It looks like we have about maybe 5-6 minutes left at this point. Doctors, both of you, I certainly appreciate your insight. Want to give you one last chance to leave sort of a final impression with all of our viewers before we wrap up this conversation. So Dr. Spinner, why don't you start?
Well, first of all, I'd like to thank you for having us here and for all of you out there with your questions. They're great questions, and there'll be more questions to come. But as a pediatrician, I can't stress enough of the importance that our goal is to protect our pediatric population. And in many ways, if we protect our kids, we protect our adults. Now, COVID may have turned this upside down a little bit as we have seen that adults tend to be the primary spreaders. But, we do know that children down really to age 10 are probably just as likely to spread the infection as adults. So we want to get them vaccinated. We'd like to get them vaccinated as quickly as we can. And we want to protect them from, the virus. And we also want our kids, and I'm going to say this as a parent, we set examples for our children every day. So we need to practice the mask wearing, the physical distancing, all of the right things as parents, so that our kids emulate that same behavior, so that when they're with others, they do what they need to do to protect themselves, their friends, their other family members. So we're all in this together, and we all need to be sure that we're continuing this for at least the near future, until we really can get that, that herd immunity to where we can then start to be back to where we were before.
Thank you, Dr. Spinner. And Dr. Chang?
Yeah, I echo those same sentiments. I think as a pediatric specialist, I just want what's best for kids. We want to protect our pediatric population, and in turn, protect our community as a whole. And so I do, highly recommend continuing all our physical distancing, mask, hygiene practices, and be on the lookout for opportunities to vaccinate our children for COVID-19. One thing I do ask, our community and our parents is, I know there's a lot of anxiety around this. I just want to, reiterate that we're learning something new about this every day. And so I don't want parents to, I know it's frustrating, but I don't want them to be frustrated with the fact that advice and guidance changes over time. We are learning something new about COVID-19 on a daily basis, if not hourly basis. And so I ask parents to be patient with the medical community, with their pediatricians, with their providers, and understand that as we learn, we will try to, as a whole, as a community, we will try to make the best decisions that we can for the children. And so, things may change over time. And it's not because we are changing our minds kind of on a whim. It's because we're getting new evidence and we're trying to make the best decisions that we can. So again, thanks for having us, and thanks for giving me the opportunity to answer any questions and address concerns that parents have. And I ask for patience from the parents for their pediatricians and for all of us.
I saw Dr. Spinner sort of nod his head too with the patients. To both of you, Dr. Spinner, Dr. Chang, on behalf of KPRC, thank you for taking time to answer these questions. We know that it's an ongoing conversation. Parents, they want answers. Everyone wants answers, and we appreciate your insight and your patience and the information you were able to provide. We know that this is an ongoing conversation, and we lean on our medical community during such uncertain times like this. So thank you both. Also, we want to thank our participants for their questions today. They're also sharing their gratitude to both doctors during this time. So we hope this conversation was helpful and informative for a lot of folks.
Yeah, we all know we have the very best medical community in the entire world. So thank you both for your time. We know you're very, very busy. Also want to remind people that we have an entire section on our website all about the coronavirus vaccine. You can follow the latest vaccine news at click2houston.com/vaccine. You can also check out click2houston.com/ask2 to look for any information you may still have questions about. Thank you all for joining us. Have a great afternoon and a good weekend.
Thank
Stay
you.
warm.
Stay safe.